Hi, Sanjeev. Nice to meet you. So do you want to tell me a bit about yourself?
Yeah, sure. Sanjeev Nishani, I'm a consultant pediatrician in Leicester. I've been a consultant here for the last 30 years now. My main remit as a pediatrician is actually to look after critically ill children. But I also have a very big interest in pediatric skin conditions, pediatric dermatology. And I do lots of clinics for children with a variety of skin symptoms. And it is during those clinics, which I do once a week, pretty much most weeks, that I started noticing a change in children's behaviors in the last 3 or 4 years. So, for instance, in early childhood, I started noticing children who came in who were non-verbal, who had this, and in fact, I saw one just the other day, and I mentioned your name because these parents came from Coventry. They were in despair because they'd been let down by the system, came in with food refusal and completely non-verbal, and was very drawn to the inanimate objects in the room rather than anybody else. So non-verbal children, children with delayed language and speech, poor posture. And when I started delving into the setup at home, the history, I was told that a very significant percentage of these children spend their entire waking hours on screens.
Yeah.
And then fast forward to the older children, seeing lots and lots of teenagers, headaches particularly. It's very common symptom.
With headaches, did you say?
Headaches, yes. It's a very common symptom. In fact, I saw one in clinic just last week. And you get a clinic sheet that just gives a brief précis of the presenting symptoms.
Yeah.
And it was a 14-year-old girl. And before I saw the child, the teenager, I'd already suspected the diagnosis was what I call the Screendemic. When I called her, she was sitting, her father was filling the registration form, and she was sitting on a phone.
She was on her phone?
She was on a phone. It was just a very brief wait. She was already on a phone because, that just reflects what I see in teenagers. So lots of teenagers with headaches. They have withdrawn from previous physical activities. They spent, this girl was spending 8 or 9 hours each and every evening. Not schoolwork, but on videos.
8 to 9 hours every evening. So that would be from like, what, for 3 o'clock in the afternoon?
She got back,
11 p.m.
Yeah.
Midnight, really, yeah.
Yeah, and more on weekends. Now, this girl was quite extreme, but most teenagers I see spend 5 or 6 hours each and every evening on social media and smartphones. So it's headaches, poor sleep, lethargy, withdrawal from hobbies, lack of interest, poor academic or dropped academic performance, stress, all sorts of things. And that got me, again, I always ask about hobbies and home habits. Again, what was a common thread was most of these children spend hours and hours, as we've already discussed. Then I started reading about it because one of the things that had already primed me was walking around, you see adults with their heads buried in phones.
It's true.
Called FOMBI, they're called FOMBI. And I thought to myself, nobody is that busy that you cannot wait until you go reach somewhere or stop somewhere to look at your bloody phone, So I was already noticing this awful change. You go to restaurants and the same thing, etc., etc. And that's what got me reading. And the more I read, the more horrified I got. And research telling us very clearly that excessive screen time, what I call the Screendemic, is not only associated with very significant mental health difficulties, which have increased 5, 6, 10 times in the last 15 years, but also delayed language, speech development, poor mobility, poor posture, neck pain, all sorts of things. And that's when I coined the term the Screendemic, which is the epidemic of mental health illness in children and young people, as well as early language development communication problems.
Okay, so one thing I really liked about your book, is you spoke about acquired ADHD.
Yes.
So I think you probably So I know everything you said is absolutely true. Like I think everyone has been witness that you walk around, everyone's on their phone. You know, you have to wait for 1 second, and you know people get an itch to get on their phone, and teenagers and young people are most vulnerable to this.
Yes.
But there's also a lot on social media about neurodiversity. So this has become quite like a popular, like, what would say, not just a buzzword, but like also like a badge that people seem to wear. Like, and I've been to some events, and I remember that about half the crowd were about my age, so that I'm a millennial, and about half the crowd were Gen Z. So people were in their early 20s and late teens. And what I noticed a big difference was that everyone who was a Gen Z, they often introduced themselves to like, hi, by the way, I have ADHD or I have autism, and I might not be able to say this clearly, but, and then they would all introduce themselves like that. So, and I think if you ask them, they would say their symptoms, ADHD and or autism, however they identify in a neurodiverse way, is something they're born with, and it's genetic. So in your book, you talk about something called acquired ADHD. What do you think about this? Because you have over 30 years clinical experience, right?
Absolutely.
As a consultant at Leicester Hospital, yeah.
So a couple of things. First of all, going back to what you just described, I will give you how that plays out in my clinic, this badge, as you call it. Parents walk into my clinic, and one of the first things they tell me when this child walks in with an iPad, it's usually an iPad, is that my child has got ADHD or autism or both.
Yeah.
It's almost said proudly, which just really disturbs me. And the second thing is that also means that, as far as they're concerned, the only way that they can regulate themselves or be still in that consultation is by being stuck on that device. Now, translate that into what happens at home. Exactly the same thing happens at home, but for many hours. And then going back to the meeting you were at, there's a really fascinating article in the Times, which I'm a very avid reader of, and it struck a chord with me. It said that in the West, what has happened is that there's this proliferation of individualism.
Yeah.
Okay.
There is that. And so you're Indian ethnicity, right?
Yes.
When were you born in the UK, or?
No, I moved 40 years ago.
You moved 40 years ago. At what age, if you don't mind me asking?
25.
Okay,
Well,
25.
not 45. 38 years ago. 65. I'm 63. 38 years ago.
Okay, 38 years ago from India. What part of India, if you don't mind?
Bombay.
Okay, right, yeah. So you basically have pretty much lived half your life in India and half your life in the UK. So I was born and raised in the UK, but I think we go back to Pakistan, I would say every year or every other year since I was born, because I have a lot of family there. So I'm obviously fluent in Urdu and really aware of the cultural differences. And I've also can see a big culture shift in Pakistan right now as well, in the last 10 years, 10, 15 years. And they have a bit of a screen epidemic there as well.
But they have a massive, India does for sure, I know that.
Pakistan does as well.
They have a massive problem. And
so I'll let you go on now.
Yeah, so going back to this individualism, this article mentioned that people with ADHD, they have better outcomes in countries where there's community. So India and Pakistan, for instance, have much greater community, don't they?
Yeah, they do.
Here we have much more individualism. Sadly, there's family breakdown, etc. All of this contributes to people being on their own, and therefore wanting and needing these badges to validate themselves and to make themselves heard, etc., because otherwise people don't take notice of that. So this is one of the things that's underpinning what you see. Now, going back to your question directly, so acquired ADHD is a condition where teenagers like the one I just described to you, who spend hours and hours on social media apps, on smartphones, develop symptoms just like ADHD. In other words, and that is because for a very clear scientific reason, and that is because the social media apps and the smartphone and the addictive algorithms and the constant swiping, etc., the scrolling affects the emotional circuitry of the brain.
Yeah.
This affects the prefrontal cortex, the amygdala, the hippocampus. So just the circuits in the brain which are responsible for how we conduct ourselves in a proportionate, moderate, reasonable manner. And exactly those parts of the brain are affected in what I call primary ADHD.
Yeah.
And in studies that have shown what happens after the habits have been optimized or screen time has been reduced, the symptoms have gone away. In societies in the East where you can tell people what to do, when there's much less individualism and human and rights, etc., then it's much easier to manage this condition of acquired ADHD. In the West, it's not so easy because it's not so easy to get them to comply. That's just cultural differences. So acquired ADHD is because of you're bombarding, you're overloading your brain with social media apps for hours and hours each and every day. Basically, it reflects an addiction.
So if I just want to understand this correctly, you're saying there's two types of ADHD, primary ADHD, which people can be born with, but people
have differences in their brain, correct. And that's outlined in my book. Yes.
And people who have primary ADHD, they usually have better life outcomes if they live in a community-centered culture, like in the East, compared to a more individualistic culture, like in the West. But you're also seeing that in both the East and the West, another condition is emerging called acquired ADHD,
yes,
where they have the exact same symptoms as primary ADHD. Apart from this is all caused from spending too much time on the screens. Correct. And if you remove the screens, within a few weeks, all of those acquired ADHD symptoms will disappear or decrease.
Basically, yes, they get much, much better. And if you extend that further, because I've said that social media apps and smartphones and devices affect the emotional circuitry of the brain, they affect exactly the same parts of the brain which are different. I'm going to use the word different in primary ADHD. In other words, somebody with primary ADHD has subtle alterations in the emotional circuitry. You then allow them to spend hours and hours on social media apps. That it amounts to a double whammy.
Yeah.
Unfortunately, the same circuitry in the brain becomes affected again or worsened by what you are allowing them to do to regulate themselves. And that's where my book comes in. And essentially, the message I'm trying to get out there is that physical activity is as good for the brain as it is good for the body. There's more and more evidence about that. And physical activity, if done consistently, regularly, of the choosing of the child and the family and the parents, then that can reverse over time, reverse some of these differences in the brain and optimize and normalize the various chemicals in the brain, which is what we need, all of us need to function normally. Dopamine, serotonin, glutamate, reduction in glutamate, GABA, reduction in cortisol, etc., etc.
So your book, Movement is Medicine, literally, I think, explained this so amazingly. I really enjoyed reading it. One of the biggest complaints people in the UK have, and I speak to parents pretty much everywhere, like all across the UK and for years now, and they will say, if you talk about autism or ADHD services in this country, the first thing they'll say is it took 4 years to get a diagnosis, or it took 3 years to get a diagnosis. All of these years to get a diagnosis. And then when you ask them, why do you, because the limitations of the NHS service is that once you get the autism diagnosis or the ADHD diagnosis, often that's the end of the road when it comes to like treatment and care and what the NHS has to offer to help your child. Like it's
Yes.
it's the end of the road is the diagnosis. So a lot of parents feel like they need to go privately for a autism or ADHD diagnosis. And when you ask them, like, it does, what's the benefit? You know that your child has ADHD or has autism. Everyone who knows your child, the teachers, the family, the neighbors, everyone knows your child has autism or has ADHD. Why do you want a diagnosis? And they will say, I want to pay privately for diagnosis so that they can get the right prescription. What do you think about that?
The the two sides. I mean, I think there are various aspects to this. One is that it's an unfortunate symptom of how the NHS is overwhelmed. The second thing is that there seems to be a tendency, as we already touched upon, that people want a label, people want a badge.
That's true. Yeah.
Which I personally find unfortunate. And the third thing is sort of from a parent's point of view, you could argue that they want a prescription understandably, because everybody is aware that the child has ADHD, autism, and if they want to feel that they're doing the most they can for their child. But however, this is where somebody like you comes in, because you can actually point out as an expert in autism from your huge personal experience that just popping pills is not the answer.
Yeah.
And there has to be a holistic approach, which you've outlined, you described beautifully. And to me, at the very least, because the NHS is overwhelmed, there should be some way of signposting parents to services that offer a holistic approach to children like you do, rather than just popping pills. Because again, you know very well, and I've written this in my book, 30 to 40% of children who get onto a medication stay on medication as adults.
Yeah.
Because the services are not geared up to review these children, assess them properly, 10-minute GP appointment. How are you going to make any assessment as to whether a person still needs the medication or not? So the whole thing, the whole setup in the NHS is particularly poor in helping people with ADHD and autism and children and families. The NHS is mainly geared towards acute problems.
Yes, I agree.
Physical problems and perhaps a few acute mental health problems. It's not geared towards what you're describing.
Yeah.
Which is a real shame. But the psyche in this country is that the NHS must take care of everything. And because the politicians are not telling the truth, that is impossible, it will never happen, a lot of people across the spectrum are being let down by completely and totally unrealistic expectations.
Yeah, you're right.
It's a whole host of reasons for this.
Yeah.
And of course, there's you then add into the mix, a lot of these families will get benefits as well once you get a diagnosis.
Yeah, you're right. If you have an autism diagnosis or an ADHD diagnosis and it's particularly severe, you qualify for disability living allowance and carers allowance and a few other. Yeah, you're right. And then with that, you get extra tax-free childcare benefits. You're right. It is, if you have that diagnosis, there is those benefits available to you, and there's a financial benefit for families too.
Well, that's right. And so I'm not saying that's the motivation. However, it just muddies the picture.
It does muddy the picture. You're right. It's a good way of putting it, muddy this picture.
Yeah. And it's a real shame. So there's a whole host of reasons that has caused what is basically a perfect storm there.
Yeah, you're right. When parents ask me about medication, I always, and Joe, you make so many good points, but what I'd like to touch on is when parents ask me about long-term medication for their child, so whether it's melatonin to help with sleep if their child has autism and disrupted sleep, or any of the like ADHD medications, which can be quite strong, I let them know that there hasn't been any long-term study to say how safe is it to give these very strong like brain medications to a child while their brain is developing for the first 25 years or the first 28 years. It's rapidly developing and growing, and we do not know the effects of giving these very strong medications to a child long term, and it's something that they haven't really considered. The second point that you said as well, which I about how once a child is given a prescription, or a person in the UK is given a prescription, it's usually a prescription for life.
Yes.
And there's nothing set up in the NHS to actually review whether this person actually needs a prescription. There's someone I know who's I'm very, very close to. She used to have asthma attacks when she was about 9 or 10 years old. And they were quite bad. And she lives here in the UK as well. And she was given steroids to take because and that it worked. It stopped her asthma medication. Stopped her asthma attacks. So from about 9-10 years old onwards, she took a daily steroid tablet. And then I don't think she got off that until she was about 26, 27 years old. And she was under the impression that she has asthma, so she needs it. And this girl, exercises really well. She was on her school netball team. She was fit and active, and she still remains fit and active. She does weight training, everything. And at the age of 37 years old, she got diagnosed with osteopenia. And she was like, how is this possible? No one my mum doesn't even have osteoporosis or osteopenia yet. And I've been lifting weights for years. And then it came about that, that steroid tablet that you took from about 9 years old up until 25 in your bone growing years, in your bone laying years, you never laid enough bone to begin with. So that just, it's John, it's really tragic because she broke 3 bones in the last 12 to 24 months, and then it got picked up. Oh, looks like you have osteopenia. Here's a calcium and vitamin D tablet, and carry on with the weightlifting.
It's terrible.
It is really terrible. So you're right, there's nothing set up in the NHS to review long-term medication prescriptions at all. If you're given a prescription, you are on it for 20 years.
Yeah.
They'll just give you a repeat every month.
Absolutely. And going back to your point, I think it's worth just elaborating a bit more about that. First of all, as you know very well, because you're an expert in this field, the medicines that are given, the drugs that are prescribed, essentially alter the chemicals that we've just mentioned, serotonin, dopamine, et cetera, reduce stress levels. Physical activity does the same.
Yeah.
And there's no concrete evidence that these work. Mm-hmm. If you look at the landscape in psychiatry, and it just makes my blood boil. When they started, the Americans, all of this comes from the US predominantly. When the Americans started classifying psychiatric diseases, there were about 20 or 22 conditions. There are now 400.
Yeah, that's quite a jump.
Yeah. So basically, they're pathologizing variations of normal.
Yeah, you're right.
Somebody who's slightly different or behaves a bit differently or has an outburst, a temper tantrum is labeled as ADHD or whatever it might be. Yeah. And they have done this in the US because that way they get insurance companies to pay out for consultations. That's the motivation. However, we have our own classification here, but actually we have followed the US.
Yeah.
And these diagnoses have proliferated to the great disadvantage of unsuspecting people.
Yeah.
They want to diagnose it because they think it's going to help them and think they're going to get better. Actually, as we've just discussed, often what happens, because the system is not ready or geared up to this, is they're given some pills, told to go away, and then they're left on those pills forever and ever. And also, studies are showing that the majority of the effect of these brain-modifying medications, let's just call them that, these medicines used, are actually placebo effects, particularly in adults.
Okay. Yeah.
So there are some psychiatric...
Can you just explain what's a placebo effect in case anyone doesn't know what
placebo effect is essentially, if you take a medication, first of all, it's comforting to know that you're getting treatment. Therefore, you may feel better because you know you're getting treatment rather than because the medication has actually made a significant difference to whatever condition you might have. So your brain assumes that because you've been given medication, you will feel better.
Yeah. Okay.
And that's half the battle when you're dealing with a medical problem anyway.
You got to
How
believe
you
it.
perceive the medical problem. So if
Yeah.
you perceive that you've been treated by this tablet and this is going to take your symptoms away, you will psychologically, many people also feel better anyway,
Yeah.
regardless of whether that tablet turns out to be a vitamin
Yeah.
or
Or sugar pill.
something specific for the condition you've gone to the doctor for. And that's called the placebo effect. The psychological improvements, feeling better because you feel you've been treated, because you feel you've been listened to,
Yeah.
and you've been heard and taken seriously. So
Okay.
a lot of these tablets actually have a placebo effect.
I want to touch on something else you said earlier, which is that the patients you see that come into your clinic, toddlers or teenagers, they're often come in with an iPad, and then the parents will say, they need that to regulate themselves because they have autism or because they have ADHD. From your so what so when they say regulate themselves, I think what they mean is to numb themselves or
Or keep still or keep quiet,
yeah,
basically.
keep still or keep quiet. Yeah.
Yes.
So from your experience, what is that screen actually doing to their brain rather than, is it actually numbing them? Is it keeping them still? Is it regulating them?
No. So I've created a 5-a-day infographic, which is like a bit like 5 fruit and veg a day that
Yeah.
people are advised to take. And this is a guide for parents, children, and families as to how much, because we have to acknowledge and accept, whether we like it or not, we have to acknowledge and accept that screens are embedded in our lives.
Yeah.
Therefore, you have to be pragmatic about that and say to people how much screen time is okay based on age. So this 5-a-day infographic outlines how much screen time is accessible, is appropriate. And for a 0 to 2-year-old, the only screen time I recommend, and this is based on American guidelines, WHO guidelines, NICE guidelines. Unfortunately, the hierarchy in our country until the last couple of weeks has been completely asleep at the wheel.
Yeah.
So this is based on recommendations and common sense as well. So basically what I say is that for 0 to 2 years of age, the only screen time should be video chatting.
Yeah.
Between 2 and 5 years of age, if you must give your child a screen, then it should not be for more than 30 minutes.
Can I ask, when you say screen, do you just include phones and tablets, or what about the TV?
Yeah, that's a really good question that I get asked a lot. Well, no. So TV is different for a number of reasons. Number one, it's usually at a greater distance. Number two, there's often communal watching. Number three, you can just switch it off.
Yeah.
In older children, well, anybody who's 5 years upwards, etc., they can just disappear with a smartphone in their pockets and go to the rooms, and they're
Go
gone.
to the toilet
And
for
go to the
5
toilet,
hours.
go to the rooms, etc., etc. So that's the fundamental difference between smartphones and televisions. That they can just take the smartphone and disappear for hours and hours, particularly the teenagers. So it doesn't apply the same weight or negativity. So for 2 to 5 years, I recommend 30 minutes maximum. Also, if you must give your child a screen, then give your child a bigger screen, because that smaller screens are known to cause stress to the eyes, and opticians are telling us that lots of kids are needing glasses. And if you must give a child a screen, consider educational content. Now, that's just the backdrop of the specific answer to your question. First of all, watching a screen is a passive process. One of the reasons children in early childhood have delayed in poor language when they're stuck in front of a screen is it's a passive process, and there's just these flashing images and sounds that are bombarding the brains.
Yeah.
Again, as outlined in my book, the language center of the brain learns language by hearing speech from parents, siblings, grandparents, friends, and picking up sounds and cues from the environment. When a child is stuck and hypnotized by a screen, they're oblivious to what's going around in the environment. They're not hearing sounds from the environment. They're not tuned into the environment.
And you
There's not,
don't see that in TV watching?
you
In TV
don't,
watching,
no, not as much,
yeah.
because again,
They're still aware someone came into the room.
correct.
Someone, yeah, they're still
Yeah,
aware. Yeah.
it's a smaller screen that you watch them. They're just completely and utterly hypnotized by this.
Yeah. They don't know who's come in the room, who's left.
They have no idea, absolutely. And again, going back to the television, again, if that's not regulated, if that's if they're allowed to sit for hours and hours, it will have detrimental effects for sure.
Yeah.
That's just a bad habit. So there are studies showing that toddlers who spend long periods of time on screens, devices, not only have delayed language because of these passive, the brain language center doesn't develop. It needs a lot of stimulation to develop. You don't get that from screens. Not only do they have delayed language and development, they also have inability to regulate their temper. So when you see toddlers taking the screen taken away from toddlers, they have serious temper tantrums.
Yeah.
Because they don't get there, they're not interacting with human beings, they're interacting with these inanimate objects. And because of that, they don't learn that no, this is not right, no, you will not do this, no, enough, no, you know, that sort of thing. And that's a very, very big problem.
Yeah.
So there's language, there's posture, there's inability to regulate emotions, having temper tantrums. In fact, I did an interview for ITV Central News once, and in that news clip, they also interviewed nursery nurses. And this was shocking and fascinating at the same time. And the nursery workers basically said that these days, when parents drop a toddler off and they leave,
Yeah.
the toddlers have a temper tantrum, not because the parents are leaving, but because they're taking the device away from the child.
Okay, that is really, really, really shocking. So for millennia,
Yeah.
babies and toddlers were attached to their primary attachment figure, which is usually the mother. And now you're saying it seems like their primary attachment figure is a tablet.
Yes. Yes. Can you imagine?
And then we see these symptoms of poor social skills, irritability, poor language learning, disrupted sleep, temper tantrums, and we call it, they've got autism or they've got ADHD.
Exactly the point. Because their language is poor, their ability to interact with people is poor, they get this label unnecessary. Imagine you start school with those difficulties, those disadvantages. Straight away, you're not going to engage in class. Therefore, the child is likely to be more disruptive because he or she is frustrated that whatever is going on in class is almost alien to them because they haven't been taught the basics
of sitting down and reading a book and having slow.
Correct. Yes. So their behavior is likely to suffer, and then they're going to get a diagnosis.
Yeah.
Because they're struggling in school, the parents are going to think, oh, maybe they do have ADHD or autism.
Yeah.
Actually, a lot of this has come from the fact that they spend hours and hours on screens and have not had a normal childhood. They've had a device-based or a phone-based childhood. Humanity has sleepwalked into this. We have absolutely, well, we're now realizing, but we have had no idea as to the destruction and devastation caused by these big tech companies.
Yeah.
Who, in my opinion, are obscenely rich but morally bankrupt because all they're interested in is making money.
I think Steve Jobs was once interviewed by the New York Times when the iPad came out, and they asked him, how do your teenage children like using the iPad? And he replied to that New York Times reporter, my teenage children have never touched the iPad.
Exactly. And if you it's regularly mentioned in papers that most of these tech CEOs do not allow their kids these poisonous, toxic devices. That says it all, doesn't it?
Just like the cigarette companies didn't smoke cigarettes themselves.
Oh, exactly.
Or they definitely didn't or the drug dealers don't do drugs themselves.
Yeah. So, but fortunately, compared to cigarette, the carcinogenic cigarettes, smoke, etc. In the last 3 or 4 years, as you know, there has been this massive awakening and awareness, thanks primarily to Jonathan Haidt, who has been absolutely fantastic. And I think this guy deserves a Nobel Peace Prize, not his president for sure, but he's done so much to raise the awareness of the toxic and poisonous effects of smartphones and devices. And of course, a lot of people have joined him. A lot of us are working in that space, and things will have to change. But of course, by the time things change, then we have to deal with the next poisonous onslaught of AI.
AI, I know, just AI friends, AI boyfriend, girlfriends, AI marriages.
It's just mind-boggling how human beings that have created so much are on the path to self-destruction.
Yeah, I really agree with that.
It is just so tragic.
I just wanted to ask a few more questions before we wrap up. You mentioned something about how the NHS is not equipped to help children with autism or these long-term conditions. It's more geared to help people with short-term or acute conditions. So, and you said that a holistic-based approach to autism is like what you'd recommend, and that's not available on the NHS. Why do you think that's not available on the NHS? And why is it that when you speak to NHS staff and you talk about a holistic based approach, they will just tell you straight away, no, there's nothing you can do. Your child will always have these autism symptoms, and you should just adapt your life now to be prepared that that's how they're always going to be because they have autism. Why do you think that is?
I'm going to answer your second question first, and I think that is because basic ignorance. Now,
Basically,
ignorance.
ignorant. Okay.
Yeah, these are very specialized fields,
Mm-hmm.
and so if you read the press, you read so-called respected people, senior figures in the NHS, saying that they don't understand why the incidence of ADHD and autism has skyrocketed so much.
Yeah.
As per our population base, our population number, they can't explain, they can't justify this massive increase in ADHD diagnosis and autism. The reader will then think that actually some people are making these symptoms up, some people are glorifying these symptoms for various reasons.
Yeah.
So the reader thinks, actually, I don't believe in this, you know. So it's because most people have very little idea of the realities of ADHD and autism. Then you throw into the mix the private practitioners who have this reputation of giving a diagnosis because they paid a fee.
Yeah.
That's also the reality. And unless you know, I only learned about this because of my specific interest, because I decided I want to understand more about what I'm seeing in my clinics.
Yeah.
The majority of people have no interest in that, and therefore they are not able to provide a valid opinion.
So your curiosity and
Correct.
other people and most people in the NHS, because it's such a specialized field, they're just quite ignorant.
Yes, that's the bottom line. So I told you earlier on when we started that I've been able to learn how to manage skin conditions. Most doctors have absolutely no idea how to manage skin conditions because there isn't the training there. Similarly, for ADHD and autism, there is very little training.
Yeah, I agree.
Therefore, you're not equipped. It's not their fault. They're not equipped to manage such complex conditions.
Yeah. Okay. I know, I understand. I see this every day and I agree with you. Because of my own background, where I graduated from dental school from University of Bristol, how many years ago now? 11, 12 years ago. I've got a lot of friends who are medics and dentists, and they all say the same thing is we don't know this stuff. You know more about, we may be a GP, we may be a paediatrician, we may be, frontline in the NHS, but you know way more about autism than we do. Okay, so after everything that we've spoken about today, are you optimistic that things will change about the Screendemic, or how are you feeling about this? Are you optimistic?
I've got mixed feelings. I was optimistic until Starmer said that he doesn't think Instagram is a problem because his daughters use it. This is in the press.
Right.
And they say it helps them make connections. And I'm in despair because I was just thinking to myself yesterday, on what ground, who in the government is qualified
Yeah, I
to
agree.
refute the pronouncements, the conclusions by the Royal Academy of Medical Sciences, which represents 20 Royal Colleges? The Royal
Yeah.
Academy of Medical Sciences has said, we are going through a public health emergency.
Mm,
And if the government is still procrastinating and says we need more evidence, we need to do it is just completely bonkers.
I
It
completely
is,
agree.
in my opinion, they are in dereliction of their duty. And whilst they're procrastinating and are totally unable to take any decisive action, we've seen that since the new government has come to power, unable to take any decisive action, the fallout from that is millions and millions of children are continuing to be poisoned each and every day by these toxic, poisonous social media apps and smartphones. It is to the huge detriment of our children and our young people, and that just makes me despair.
Yeah. Yeah,
And
I
it was
completely agree.
just so sad. So I was optimistic after the Lords passed the bill recommending a ban on smartphones. I think it's going back to the Lords again tomorrow. But because this government is incapable of being decisive, I'm really, really concerned.
Yeah, I think that's a very, very fair point. But I think it goes further than just social media. So if we are able to do an Australian style ban in the UK, fingers crossed, I hope it does come into force. Like no TikTok, no Instagram, all of
Yeah.
those social media apps for children under the age of 16. It still leaves the problem of these kids will probably still have access to YouTube Kids. They'll still
Mhm.
have access to, I don't know, video games and Roblox and I don't know, other screens, other things that they're watching on their screens. So it doesn't take away the problem of screens. I think it just, but social media is another can of worms, and hopefully that means one can of worms kind of closes.
Absolutely. There are many different poisons and ills. However, I think we have to include smartphones and social media. Because, in my opinion, there is no moral, ethical, psychological, educational, or pastoral justification for allowing smartphones at anybody under 60. Absolutely none.
Yeah,
And laws have to be passed, and then there can be iterations of those laws. Because we know in Australia, a lot of people are getting around it by using VPNs.
yeah,
One of the amendments in the bill going to the House of Lords is actually also to ban VPNs. In other words, you pass a law which is well meaning, and
yeah,
then you keep assessing it.
yeah,
That's the point. You have to start somewhere. You have to give parents the ammunition to say, sorry, Jill or Joe, I cannot give you a smartphone because the government has banned it.
yeah. I
That
completely agree.
stops the daily arguments that parents are having. Parents are having to battle against this poison that has been disseminated by big tech companies. It's an unfair fight.
Yeah, it's so addictive.
Therefore, yeah, the government has to say this, and the government also has to say to schools, we want you to ban no guidelines, no ifs, no buts. So when a small minority of parents go to the head teacher to give them a hard time, all they need to do is say, ain't us gov. The government has said this.
Yeah,
Sorry,
exactly.
there's nothing we can do about this.
Which is exactly what they say when it comes to taking holidays from school. You're like,
Yeah,
how can you not let us take 2 or 3 day extra family holiday to see our extended family? They say, sorry, it's not us, it's the government.
yeah, exactly.
They do, yeah,
So the government needs to give ammunition to parents
and
and
schools,
teachers and
yeah,
schools. And that is then beginning to address the problem. Nobody says this is the panacea. There also needs to be a public health campaign
yeah,
about gaming addiction, because nobody's talking about gaming, where
yeah,
lots of boys are being addicted to games. In fact, that's why I've got a chapter in my book. They think gaming doesn't have the same effects. Absolutely not. Gaming
yeah.
has exactly the same poisonous effects as social
Yeah.
media does.
Right, Sanjeev, thank you so much. Do you want to tell my audience where they can find you and tell them a bit about your book as well?
Sure, thank you. So my book is called Movement is Medicine. So it's available medicine. It's available Amazon. Movement is Medicine describes the therapeutic effects of physical activity on common mental health disorders in children and young people. In other words, it is a guide for parents, children, and families, and it shows in easily digestible language how regular, consistent physical activity optimizes brain, the physical structure of the brain and the chemical structure of the brain, and how regular, consistent physical activity will allow you to potentially delay starting medication or reduce starting medication or come off medication in your child who is on medication for any of these conditions, such as anxiety, depression, ADHD, autism, screen addiction, and gaming addiction. And it also demonstrates how physical activity is good for gut health, which, as I'm sure your listeners will know, is very topical, and good for long-term resilience. So the book has a wide spectrum of chapters about how moving regularly is good for the brain as much as for the body.
Yeah, thank you, Sanjeev. I recommend the book to everyone. The book was a really good read, and I learned something from the book as well. It was really good. Right.
Thanks very much.
Thank you.